Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What is a normal sinus rhythm? Normal sinus rhythm, NSR, is another name for a normal heart rhythm. The heartbeat is controlled by electrical signals that are transmitted to the four chambers of the heart, causing them to contract and relax in sequence to pump blood in and out of the heart. /r/n/r/n. However, the sinus rhythm can sometimes become irregular, referred to as sinus arrhythmia, and cause the heart to beat too slowly or too rapidly. /r/n/r/n. This article explains how the sinus rhythm regulates heartbeats. It also discusses how different arrhythmias occur, including their various causes and symptoms. /r/n/r/n. Sinus rhythm is the pattern of your heartbeat. Heart rate is the number of times the heart beats per minute. A normal sinus rhythm is associated with a heart rate between 60 and 100 beats per minute. /r/n/r/n. The heart's normal rhythm is referred to as sinus rhythm because the electrical signals, called impulses, are generated by the sinus node. /r/n/r/n. These impulses are what appear as up and down patterns of an electrocardiogram, ECG. With a normal sinus rhythm, NSR, the pattern will be uniform with high and low impulses falling within normal parameters. /r/n/r/n. The pattern of electrical impulses reflects the way that the chambers normally beat to allow blood in and out of the heart. There are two sets of heart chambers, /r/n/r/n. The sinus node consists of a group of cells called pacemaker cells that are clustered in the right atrium of the heart. These cells produce electrical impulses that cause heart chambers to contract and relax in order so that blood can move through the heart as follows. /r/n/r/n. An abnormal rhythm is one in which the rate of firing is irregular and either too slow, too quick, or erratic. /r/n/r/n. When heart rate becomes too slow it is known as bradycardia, and when it's too fast it is known as tachycardia. /r/n/r/n. Sinus arrhythmia can sometimes be so brief that the overall rhythm isn't greatly affected. But some, like those that produce shortness of breath or dizziness, may point to serious conditions. /r/n/r/n. There are a number of circumstances in which it is normal for the sinus rhythm to be at the low end of the range of beats per minute. A slow heart rate is referred to as bradycardia. /r/n/r/n. Sinus bradycardia can occur normally during sleep, when most people experience a dip in heart rate to below 60 beats per minute. Trained athletes can have resting heart rates in the 40s even while awake. /r/n/r/n. Bradycardia may also be related to health problems that directly or indirectly affect the normal sinus rhythm. These include /r/n/r/n. Other medications can also influence the heart rate, such as betablockers, calcium channel blockers, and digoxin. /r/n/r/n. A slow heart rhythm without symptoms is usually no cause for concern. However, when the heartbeat becomes too slow to pump enough blood throughout the body, treatment may be needed. This may include the use of a pacemaker. /r/n/r/n. If your heart rate is too slow while awake, you may have a disorder called sinus node disease or sick sinus syndrome. Symptoms include /r/n/r/n. Sinus rhythm that is abnormally fast is referred to as sinus tachycardia. It can be normal for the heart rate to speed up during exercise to ensure there is extra blood to fuel the activity. /r/n/r/n. Sinus tachycardia also can occur in people for any number of health reasons, including /r/n/r/n. Some people have tachycardia for no apparent cause, referred to as inappropriate sinus tachycardia, IST. A similar condition called postural orthostatic tachycardia syndrome, POTS, occurs when a person stands upright, causing tachycardia without a drop in blood pressure. /r/n/r/n. Sinoatrial nodal reentrant tachycardia, SANRT is a rare type of tachycardia caused by having extra electrical pathways in the sinus node. This triggers recurrent bouts of tachycardia that may only be resolved with a treatment called cardiac ablation used to block faulty nerve signals. /r/n/r/n Tachycardia may not cause recognizable symptoms in some people. When it does, symptoms may include /r/n/r/n. Yes, anxiety is one possible cause. Some people who experience anxiety-related sinus arrhythmias may benefit from meditation, yoga breathing, and similar practices. /r/n/r/n treatments will depend on your individual response to medications, your health history, and any underlying causes of the abnormal rhythm. /r/n/r/n Common treatments for an abnormal rhythm include one or more medications, surgery to implant devices that control the heartbeat, and other procedures to treat problems with electrical signals. /r/n/r/n There may also be treatments to address any underlying issues or conditions that are contributing to the irregular rhythm, such as electrolyte levels, high blood pressure, heart disease, sleep apnea, or thyroid disease. /r/n/r/n A sinus rhythm is the beating of the heart caused by electrical impulses from the sinus node. The sinus node is a group of cells in the heart that generates these impulses, causing the heart chambers to contract and relax to move blood through the body. /r/n/r/n A normal heartbeat is referred to as normal sinus rhythm. An abnormally slow heartbeat is called bradycardia, while an abnormally fast heartbeat is called tachycardia. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.